For Women's Health Week in May, we want to talk about different topics in women's health, including prenatal care, when to be concerned during your pregnancy, and when to call the doctor, and safety of care during the pandemic, all those topics and more. I'm with CU Medicine OBGYN, Dr. Lisa Wynn from our CU Medicine Obstetrics and Gynecology South Metro. Thank you for joining me.
Thank you for having me.
Of course. So first, I just want to kind of talk in general. Many have put off doctor's visits over the last year. Why, during COVID, why is it important for women, especially those that are expecting, to keep up with their appointments?
Yeah, prenatal care is really the key to making sure that you have a healthy pregnancy, a healthy labor and delivery process, and ultimately a healthy baby. So there are things that we look at every single prenatal visit that help us ensure that things are moving along appropriately and that you're having a safe and healthy pregnancy.
When should someone call the doctor when they're pregnant?
There are different times that you should call your OB when you're pregnant, or your OB provider, midwife, whomever is taking care of you. Whenever you're bleeding in pregnancy is not normal. So we need to hear from you if you're bleeding. If you're concerned that you're leaking fluid, that you may have broken your water early, that's also a time to call. After 24 weeks and 28 weeks, we start to monitor movements more. So if babies aren't moving appropriately, then we need to hear from moms as well. And then certainly whenever you're in labor, we want to hear about that. For first time moms, we recommend that they call when they're contracting every 5 minutes for an hour. And when you've had a baby before, every 7 minutes for an hour. That changes if you live further away from the hospital. We have some patients who live 45 minutes, an hour away from the hospital, and we may have them call us a little bit earlier.
Are ultrasounds safe for mom and baby, and when are those needed?
Ultrasounds are safe for mom and baby. Ultrasounds are sound waves. They're not radiation. So when you get a traditional x-ray, if you're getting an x-ray of your lungs or of a broken bone, that's radiation. Sound waves are what we use for ultrasound, and those are safe. If you were to leave the transducer in one spot for a very long period of time, that might cause some increase of heat being transmitted. That's rare. We don't do that. We're constantly moving, and the ultrasounds don't take very long. We do ultrasounds early in pregnancy to verify that the baby is there, viable, has a heartbeat. We do another one at 8 weeks to make sure everything is still in line with the growth and what we expect the baby to be at that point. And then we do one at 12 weeks, 20 weeks, and then sometimes we'll do growth ultrasounds in the third trimester.
During COVID, this past year, being pregnant, having a baby, there's obviously challenges there that others have not had to experience. It's been extra challenging. Talk a little bit about how prenatal care has changed during the pandemic.
So prenatal care has had a real evolution over the course of the pandemic. Initially, when we were put into lockdown, we tried to minimize how many patients would be in the office. So many of our patient visits, including some of our prenatal visits, were moved to telehealth. So remote physician interactions is a whole new thing for many patients and many providers alike. As things have progressed and more people have been vaccinated and case numbers have gone up and come down and gone up again, we've been able to change some of what we're doing in terms of office visits. So for most of the pandemic, our OB patients have been back in the office in person. And now we're inviting a support person to come along with them as well. So your COVID has been a real challenge for everyone. It's a challenge for providers. It's certainly a challenge for patients. The COVID vaccine is now available. So this is a conversation that we have with every mom, every visit. How are you feeling? How are you staying safe and keeping yourself protected? And do you want to get the vaccine? And the COVID vaccine is just a little piece of messenger RNA. Doesn't change your DNA, doesn't change the baby's DNA. It's a little message to mom's system saying, make antibodies to this particular part of the coronavirus, the little spike protein. And then once your body has made those antibodies, it will share the antibodies with the baby. And we know that moms share antibodies with babies all the time. We do this for pertussis, we do this for flu. This is well-studied, safe, good medicine.
You provide care at CU Medicine OB-GYN South Metro. Talk about your approach to caring for patients.
Our practice has a team approach. We have 6 obstetricians, so we do try to make sure that patients meet all of us so they have an opportunity to connect and they're not meeting somebody for the first time at the time of their delivery.